Kirsten from I Know What's Up, and I am very honored to be sitting here with my chiropractor, Dr. John Bergman. Thank you so much. So
It's my pleasure.
I wanted to give people a glimpse at what it's like to go through this process. So if you don't mind, I want to go ahead and let you do the review and let people see what that's about.
Okay, cool. We're going to start off by looking at the X-rays. Now, we're going to look at the first X-ray that we took here on the left and the current one here on the right. When we look at what a normal is, now this is in Kirsten, a normal neck should have a curve in the front, the top should be over the bottom, and all the bones should be about the same shape. In a reversal of a curve, that's not good. That's called stenosis or narrowing. Now, here, this is a negative 18-degree bend. And we can see up here, and I don't know if you can see the cursor, so this one here is a negative 18-degree bend. Where she has a curve, she has beautiful, beautiful disc spaces. But this is a significant destruction of the joint. Now, the top number should be 0. That's the top of the neck should be over the bottom. So she went from 38 millimeters forward head carriage down to 19, and a negative 4-degree bend, not a negative 18-degree bend. Now I'm going to blow up this area because you're going to see some cool stuff. See, the way a bone should look like, okay, it should be round on the end here. Okay, when we see an elongated area like this, that's not good. That's called osteophyte, or that's the body stabilizing an unstable segment. What you'll see now that the disc space is getting bigger, here, let's try and get these to the same size. Now the disc space is getting larger, this bone spur won't be needed as much. So it will get smaller and smaller and be absorbed by the tissue. That's called Wolff's Law. Now when we look, and you got to figure that's significant. To have a reverse curve with that much degeneration was a significant trauma. When we look at the front portion, and again, we're looking at before here, current here. Now this is based on 180 degrees, so that would be a 3-degree, a 3-degree, and a 4-degree bend. Or we're looking at a 10-degree buckling of the spine. We can also see that the body's leaning off to the side a little bit. It's down to a 4 and a 1 or a 5-degree bend. So about a 50% correction. But first, second, third, you'll see as we go through some of these changes, okay, we're seeing that the body has had multiple traumas and multiple recoveries. So when we're looking here, this is about the straightest that the body's ever been. And what that means is that's more of an adaptation to physical, chemical, and emotional stress. And the neck looks a heck of a lot longer here. That's only because of less rounding over the shoulders. So that's ideal. And you can see all the others had more of an antalgic lean. So we're actually seeing the body better balanced and better forward head carriage and a better curve too. So that's a plus. When we look at the low back and let's look at the lumbar, there's a 1-degree and a 1-degree bend. So there's not a heck of a lot of lateral deviation here. It's down to a 1-degree bend now, but I want to show you the lateral, the side view. When we're looking on the lateral aspect of the lumbar, we've got 5 bones in the low back. So the low back curve should start up here. What Kirsten's has, it's kind of hard to see because it's blacked out up here, it was going backwards and then going forwards. Now we got 1, 2, 3, 4, 5 bones. We're starting to see more of a curve. What we want to see in a perfect human is this curve comes all the way around, okay, where we're seeing the curve more accentuated. And there's even a sign called L3 gravity line where you draw a line from the middle of this straight down. It should intersect the anterior third of the sacrum, so we still need to get a little bit more of the curve back. The coolest one, honestly, is to see this one, to see the disc space regenerating and less of a posteriority. Yeah, so that's excellent.
Awesome. So that makes me happy. So we'll start my interview now, okay? So I wanted to explain, I'm doing a series, you've known me for a long time, and you've seen me transform. pretty dramatically. And I came out here about over a year ago, February 2020, and I started to do YouTube videos to try and just chart my progress for myself originally, but then I got the courage and I put it out there. So I wanted to do a series on reversing age, because I feel like when you have pain on your face, you look older, you know? So as the pain goes away, and I don't really have that much pain, you're laughing at me.
Well, because when you're talking about aging, I know that painful look, okay, it gets at, but holy moly, pain is 6 months, shrink the brain 10 years, equivalent to 10 years of aging.
Wow.
Okay, pain decreases telomere length, and that's how many cells your body can produce. So pain actually does physiologically age you faster.
Okay.
Okay, and that's including if you're taking opioids to cover it up. So, you know, I mean, the only solution to pain is fixing the freaking cause.
Right. So I have been looking younger and younger, and really this idea that doing chiropractic can reverse your age or make you look the way you were intended to look in the first place. So that's what this is about. Now I wanted to ask you just a little bit of a personal background on you. So how long have you been doing chiropractic?
Not long. I've been around like 25, 26 years. I mean, I'm working with guys who've been doing it like 50 years, 50, 60 years. So these guys are rocks.
Okay.
Yeah.
Okay. And what made you get started in chiropractic?
Well, I was actually a contractor, and I was building buildings and owned a cabinet shop for a while. And then I was run over by a car and had both my legs broken, my sternum fractured, skull fractured. Still got a really cool scar. Okay. But the last job I did was I was putting an X-ray lab in for a chiropractor, Mark Anthony. And here I am, and before I got hit by a car, I threw my back out, put lead sheets up, and he teaches me about my body. He adjusts me, and that searing pain I had went right away. And me and him talked for a couple of hours, because it was like, how does the body actually work? Because no one ever teaches you. You're not taught in schools that the body actually gives symptoms for a reason. And so afterwards, he says, you'd make a really good chiropractor. You got good communication skills. You're built like a tank. And I said, Doc, come on. It takes me $6,000 a month to live. I got 4 employees. I ain't going back to school. 2 weeks later, hit by a car. Okay, and so I had to decide, because it was hard to work. And the medical doctors were saying that I could get my knees replaced, my hip replaced. God knows I thought I needed my brain replaced. But Dr. Anthony was saying, no, man, your body's built by God. It's intelligent. It's going to heal. And so I respected these two people, but Dr. Anthony was right. Wow. And so I went back to school, and it turned out that I had a really good knack for memorizing stuff. And then I got into human dissection, and I taught that for 8 years. So I had everyone from the first trimester on, because it made sense. I mean, you could see it. It was like reading plans of the building. I knew how everything was working. And then I ended up tutoring biomechanics, then teaching biomechanics, then a few other techniques. And I had masters to learn from. Wow. And so these were the guys that were not schooled in how to apply the right insurance form. These are guys that had their lives saved from restoring that power that brain has, that innate inborn intelligence. So I came out like a friggin' evangelist. It was like, we'll get you. We'll turn that power on from above down. Okay, and it's true.
It's true.
Because that's how human beings live. And
Right.
we're energetic beings. It's so foolish to give a toxic medication to alter symptoms. That doesn't make any sense.
Right. And as you said, you taught anatomy and physiology, so you really come at this from a completely unique angle. Because I wouldn't say most chiropractors have had anything more than a class. They didn't necessarily teach it, not to puff you up a little bit.
No, they do. They have double the anatomy, double the physiology of any medical doctor. Okay, and that's still not enough. But what they're also taught is memorize and regurgitate. Okay, just like all medical doctors, except it's way worse in medical school, because it's memorize and what drug, memorize and what therapy. So it's always this symptom, okay, requires this therapy.
Okay.
Instead, what the masters taught, okay, and what I teach my patients, is the symptom's there for a reason.
Yeah. And
Okay, so it's really an adaptation. So to deal with the symptom without addressing the cause is foolish.
Right.
And that's why most of the drug interventions, they're toxic therapies that actually damage the body.
Right. And I remember for 2 years I watched your YouTube channel because I was very anti-chiro.
Oh, I don't blame you.
I really was.
I'm anti-everybody.
I thought you were all quacks. That's the truth, though. But I was blown away because you were teaching way back then, and this is years ago, that the body's intelligent and that it's responding correctly. So I'll go into that a little bit later, but I love that. That was a big draw. Like, you were very different to me than other people. And I was determined to get here. This was before my accident, and then I had the accident. So the universe is always watching.
Compliant.
So, and then also, you do things a little bit differently here than other chiropractors. So you've kind of set up your own method, and you've actually had other chiropractors come in and learn with you, and I've asked them when you're not listening, is he really any different? What did he teach really any different? Oh yeah, very different. So,
I know, isn't it?
Yeah. So it's helped me. I can remember the first time I walked in here, I had a bad chiropractic experience, and after my accident, and I was like hopeful but terrified, really. And I'm sure there's other people out there that might be terrified of this experience, but I'm going to tell you that this has really helped me tremendously, and there's really nothing to be afraid of.
Well, one of the cool things, okay, when you're in school, you know, you're a panic student and you just want to get out, be able to pay off your loans, and maybe buy a house and car and, you know, live. Okay, and so we had this one doctor go in there and said, well, you'll be accepted with most insurances, and you know, you have a status as a primary care physician and all of this. And I go, oh, okay, that's cool, that's nice. The other doc comes in, and you know, these are guys practicing in the field. He shows up one X-ray of a spine that's bent, another X-ray of the spine that's straighter, and says, this is what I do. I'm a gun steady chiropractor. And I thought, oh my God, I love this man. Okay, you know, because proof. And then we were encouraged to go to different offices when I was in school in the 90s that you know, look at different techniques, look at how they communicate. And I worked with this one guy, okay, and donated my time so I could just be with him. Because he was doing 13 different stress views of the body, of the neck alone. I mean, we're talking positive Z, negative theta Z. I mean, just all these different views. And I'm marking 1200 speed film. So I like the idea of finding a problem, doing some therapies, and doing the exact same test to make sure the problem is there. I mean, we're doing before and after X-rays. You can't BS X-rays.
No.
Okay? With 90% of the nerves coming off the spine, there's no pain fibers. You got to have an objective analysis, and most chiropractors today don't use that.
Yeah.
And so their therapies are designed mainly on symptoms, which is only working 10%. So, wow, doc, I feel better after that adjustment. And, you know, next week, oh God, I'm still pooping on myself. I have no bowel or bladder control, or I can't sleep, or anything else. Or, you know, there's no objective analysis, and that's what I like.
Yeah.
Yeah.
And we'll get into that a little bit. So we're going to go back to the basics a little bit, and we're
Okay.
just going to ask you, what's a subluxation?
Subluxation is a chiropractic term that they're trying to wipe out of chiropractic.
Really?
Yeah, the whole medical industry that's why 86% of the schools are no longer teaching chiropractic. But what it is, the definition, a subluxation is a bone that has a vertebra that has lost its juxtaposition in relationship to the vertebrae above and below, that is affecting how the body regenerates and adapts to the environment. So it's really a bone that's misaligned, affecting the nervous system.
And you kind of come in there and, you know, align it.
This is the weird thing, okay, because it's never one segment. It has to do with the brain. So it's the position and motion, and then the brain has to fire it, because the muscles on either side of the spine, they're not under conscious control. They're called postural muscles. So what the biggest thing is, okay, and this happens like so many people, is I can't relax during my adjustment. Okay, cool. We're working with muscles you can't even tighten up. But what chiropractors do is when they're adjusting the neck, if they start to turn the head, all the sensors on the joints, and you have joint mechanoreceptors, you've got muscle spindles, you got the ligaments with sensory component. So the more you turn ahead, those more those muscles fire. And the way most chiropractors do is they'll twist the head and then bam, twist it further. And you'll get a pop. But by doing all of that extra stimulation of the brain, you're not going to get a post-X-ray change.
Okay.
So you're not going to affect the body permanently. And so it's really altering the brain's awareness of the body by changing the segment. So we move that segment, then we have our patients, walk on the beach, do a cross crawl, get on the vibration plate, because it's the position and motion, but it's the communication of the brain that affects that permanently.
And proprioception, which we know is that's in the back right here, proprioception is?
It's your brain's view of the body's position in space. And proprioception, each sensory input, and this is from every joint in the body, that sends information into the brain. That information is synapsed in the small brain in the back called the cerebellum, and that actually controls the frontal lobe. And the frontal lobe is anxiety, stress, depression, impulse control. And if you know, just take depression and anxiety, there's a gut-brain connection. So if you have an anxiety, stress, or depression, and you're not looking at gut health, then you're missing 80% of the picture. If you're not looking that the spine sends signals up to the cerebellum, which controls that area of the brain, you're missing the other percentage.
Right, because we're, and I wrote down here, physiologically, which you did a lot of explanation of that, of the body during a subluxation, is this brain organ communication system going, brain, muscle, brain, everything.
And that's it. And it's what the chiropractors do, they call it the safety pin loop. The brain sends 1 billion impulses a second, each second down, to control and coordinate every function of the body. That controls hormone function, controls muscle activity, and organ function. And then there's a feedback loop coming back up, and that's part of what's called the 33 principles of chiropractic. But it's really basic common sense. I mean, if your perception is danger, your heart rate's going to be elevated, and the liver's going to be breaking down glycogen and glucose, so blood sugar will be elevated. And when you're in a stressed state, you don't want blood going to digestion, you want blood going to arms and legs so you can run away from the danger. Yeah, so those are normal responses.
Sympathetic response.
Sympathetic, but those are a normal response based on that perception. And in crazy stupid world, they'll give a beta blocker or blood pressure drug or a diuretic, then they'll give some antacids, then they'll give, and those are foolishness.
They're stopping the body's normal, correct response.
Exactly.
Yes.
And those are chemical stressors that puts the body in a further state of stress without addressing the underlying cause.
Because the body is?
Self-healing and self-regulating. I know. That's what everybody learns. And you would think this. Okay, think of this. Every doctor on the planet learns this stuff. Okay, the body is self-healing and self-regulating. Okay? And then you go into practice and you think, well, I'm going to decide that you have high blood pressure, high cholesterol, or elevations in blood sugar. So I am smarter than your body, so I'm going to give you this cholesterol-lowering drug, which causes increased cancer rates, heart failure, and hardening the arteries. Well, I'm going to give you a blood pressure drug, which increases your risk of stroke and damages the kidneys long term. Or I'm going to give you this antidepressant because you're obviously sad. Because I've given you 3 drugs already and she's still not healthy. So in this antidepressant, we don't know how it works, but it causes suicide and suicidal thoughts.
Yes.
That's common. That's foolishness.
And that's
completely ignorant.
And that's in the
it's on the package.
Package that tells you.
Yeah, for God's sake, if you're taking drugs, don't read the package.
Yeah. Or do read it. So is the pain and inflammation always associated with the problem? So in other words,
never.
Okay, so I could have hip pain, but it's not the hip that's the problem.
Exactly. So why is the hip, and there's a way to explain it. So you fall off a bike, your hip hurts a little bit, and you start walking, and your gait is a little bit off. Is this going to affect your shoulder?
Of course.
Of course.
Yeah.
If I stood on your foot, and caused you pain, would your heart rate elevate?
Of course.
So falling off the bike, hurting your hip, that could affect the shoulder, it could affect the gait, it could affect everything. How are you going to be sleeping every time you roll over on that hip?
Yeah, a little funky.
A little funky. Okay, so that's going to put you in a fight or flight state, limiting the body's ability to heal. But in crazy, stupid world where we are, the hip pain is only addressed by the hip, because when you got stupid insurance, okay, and most of it is, it's total sick care. Okay, the doctor who knows little to nothing about the biomechanics, neurology, or adaptive physiologic responses from that hip. Okay, you go into them after not sleeping correctly, and you say, yeah, my hip hurts. What's it going to do? Give you a non-steroidal anti-inflammatory, which destroys the building block of cartilage, damages the kidney, and increases heart attacks by 20%. Then he's going to give you a muscle relax, which is a central nervous system toxin. Then he's going to give you an antidepressant because you're sad. Okay,
because you hurt so much.
It's just
so why not be sad? I mean, who's happy in pain?
Yeah, and so that's why the most accurate that you could tell me your symptoms are, it's 10% of your body. Right. 90% of the nerves that come out the spine, there's no nociceptive firings or no pain fibers. Mm-hmm. So when you get a doctor that goes down and tell me, how would you rate the pain on a 1 to 10 scale? Okay, 10 being the worst. Okay, if you're sick of that, you should be, because it doesn't help the doctor at all.
Yeah, and I don't know how many people, and even in my own experience, I got injured at work, and they made me go, to do this workers' comp. So I went to the doctor, and it was a complete waste of time. She wasn't treating me as one whole body.
No, you were a shoulder injury.
I was a body part injury, and I was like, I'm not coming back. I never went back. I'm like, I know where I need to go. Came here. That's all gone, because that was kind of a lower back thing. So it's important not to zero in where you feel the pain, because you really need to come in, get an X-ray, have a chiropractor look at that spine.
And the spine is one thing, but the key is that the symptom is the alarm. Okay,
it's a good thing. We want the symptom.
Oh, hell yeah! And so you want that alarm, but you got to find out why it's going off. So you got to fix not just the problem, but the adaptations to that problem.
And the adaptations in themselves are excellent things. That keeps you alive.
It keeps you alive.
That, just like those bone spurs coming off my neck.
Because that idiot doctors will say that's calcium deposits, and it's not. It's an ossification of the anterior longitudinal ligament based on the destruction of the disc that's causing an increased or a hypermobility, and so that's there to stabilize it. So it's really an adaptation.
Yeah, and a beautiful adaptation.
A beautiful adaptation. Yeah. And that's why that hip pain is like an example. You got to figure out what caused it and what were the adaptations. That is the key.
And it tells you everything.
It tells you everything. That's why we do nerve scans, Xrays, thermography, blood analysis, because I want to see. And then when you fix the friggin' thing, you got to do post nerve scans, X-rays to show you're actually fixing the problem.
Right.
Yeah.
Okay, so let me see this. Okay, so we kind of discussed this, but I'm talking about how, when you go to the doctor, they do zero in, and even in anatomy and physiology, when you're learning parts. Mm-hmm. But you're also learning that you're one whole body that works together, one system, and you kind of talked about that a little bit. So I guess what I'm saying is, can you explain the danger in stopping at one body part?
Oh, yeah. A lot of people will come in and say, it's my L5, it always goes out. Okay?
I don't do that.
No, you don't do that. Not since we've had that Vulcan mind metal. 2 minds 1. Okay, so now you don't do that. But it's so simple to do it. It's like I wrenched my knee speaking at a chiropractic office about a month ago. Mm-hmm. Okay, now was it my knee's fault? Or was it my calf's fault? Or was it my pelvis' fault? Or have I been sitting with that phone piece? Have I missed doing, so that one symptom, there's a lot of other problems. The problem with most doctors, we are learning anatomy and physiology part by part. Okay, but you got to tie it in.
As one whole system.
If you have the basic philosophy, and the basic one is the body is smart, okay, it responds to the environment intelligently. And you might say, well, what about anaphylactic? What about shock? Yeah, it's responding correctly based on the stimulus. So if you got a shitload of histamines based on one environmental protein, and then you're going to have an overreaction like peanut allergies or something like that, that the body's still responding correctly, okay? And it's not lack of histamines or lack of medications that calm it down. So the body responds correctly based on the stimulus. Is that high blood pressure? Yeah, the body responds correctly based on the stimulus. Now you got to look at the stimulus. Okay, is that a physical stressor, chemical stressor, emotional stressor? You're going to find out it's probably 3 for 3, because you got to address all 3, because your body is going to respond the exact same to physical, chemical, or emotional stressors. And then that'll tighten up the postural muscles. It's like if we just watch a scary movie, okay, the postural muscles run from either side of the head down to the sacrum. They're going to increase in tone. And if you fell off a bike when you were 7, or that dancing injury when you were 14, and forget the staircase that you slipped down, okay, and all of these traumas could have happened months and months and months ago, okay, these are all going to be adaptations. Okay, so, we got to fix the adaptations.
Okay. So just explain chemical, emotional, physical, because that's been the hardest thing for me. And I'll just let you explain it.
Okay, this is the cool thing. Okay, so like I would torture guys when they were around the cadaver. Okay, figure like 20, 25 people were always there while we were dissecting and teaching. And I'd pick anybody and I'd say, what's the connection between the hand and the eye? And,
So, hi, I'm really sorry, but it did cut out a little bit during my interview with Dr. Bergman. So I wanted to kind of explain when he was talking about chemical, emotional, and physical, what he was trying to say in the best way I can. So basically he was talking about when you pinch someone's hand, you're going to get the pupils dilating. And what that is a sympathetic response. Your body has certain sympathetic responses, like pupils dilating so you can see because it thinks you're in danger, and it doesn't distinguish what the danger is. So you just have these certain responses. The digestion sort of shuts down, glucose runs to certain muscles so you can run. That's why they call it fight or flight. And he was explaining that emotional things can put you in a sympathetic state, again, because the body is not distinguishing what the problem is. So you even actually literally thinking about a past experience, you're kind of reliving it, you're re-putting your body through that experience by thinking and grieving and all that. You're actually reliving it. And also chemical, like pharmaceuticals or maybe toxic food you eat, toxic water, can also cause some problems with your spine. And in some ways, those chemicals, when they're trying to stop an increased heart rate or beta blockers or whatever we're talking about, they're designed to do that. But what Dr. Bergman is trying to explain and teach is that your body is intelligently designed, and the reaction and response it is having is the correct response. And when you try to stop that correct response, you actually create more problems for yourself over the long run. And then it's chemical, emotional, and physical. And obviously, physical we don't have to talk about so much because we understand what physical is. You've had an accident, you've hurt yourself in some way. Or even just, going through the process of adjusting and changing your body. You're going to go through this process where it takes time, and you're not going to have this magic one adjustment and just feel better. That's not how it works. So that's kind of what he was explaining it in my basic way, because you can see he's obviously an extremely intelligent man, and he explains it in a way that I can't right now, but maybe someday. So I hope that helps, and then back to the rest of the interview. And I'm so sorry about that. If I ever get the chance to talk to him again, we'll focus and zero in on just that. All right, thank you, bye-bye.
Yeah.
Okay.
Okay, so we'll wrap this up. So can anyone benefit from chiropractic, even people who have had surgery, kids?
Well, any human being on the planet, knowing that the nervous system controls and coordinates every function on the body, okay, every function is controlled by that nervous system. Every human being on the planet should be checked. Okay, whether they can benefit or not, like I'll check, this is kind of cool. Okay, we have a lot of educated parents. Some of these parents have never had a vaccine or a medication. And they have been educated by their parents who are probably hippie wackos. Okay? When these creatures give birth to this beautiful baby, okay, and they'll bring him in usually in the first couple of days, I'm looking at a beautiful human being. Mm-hmm. No C-section, no Pitocin, no epidural. Mm-hmm. Okay, the C-section is 4 times the amount of pressure on a kid's neck. I'll check their spine. There's no need for an X-ray or anything else. And that kid just got checked.
Right.
And so we check kids like that for no charge during the first year.
Because really, the natural pregnancy could be a big stressor. So every child should be checked too.
Absolutely. I mean, what I'll tell my patients is, they say, when should I bring my kid in, doc? Well, wait till they're sick as all hell. Or we get them in and maintain the health of their immune system.
Because maybe they'll have less adaptations in the body.
Maybe they'll have less adaptations.
Easier to work with.
Yeah.
So great. So there's a lot of good chiropractors out there, and many come through this office to learn from you. So, and you do something called corrective chiropractic. Mm-hmm. What's the difference?
The difference is an objective analysis afterwards.
Okay.
And so we're scanning the heart rate variability, a rolling thermo, surface electromyography, digital X-rays, stress X-rays, and post-thermography and blood analysis. So anybody that does a series of therapies, okay, and the tests afterwards to document the structural changes, then they're doing good.
Okay.
That's corrective.
Well, thank you so much, Dr. Bergman. I hope this helps people who hear it, and maybe they'll come see you or go see another chiropractor. I've got your list of 7 things to look for in a chiropractor.
Awesome. And Hun, okay, if you guys could see the transformation from pain and hurt, and the courage that it takes, I don't know if people know this, okay, but you get so many doctors that are assholes mm-hmm. that say, this is your condition. Bam. Okay, you now have something tattooed on your forehead, okay? And this is your thing because they're smarter than your own physiology. And you didn't freaking listen. Okay, you knew there was a solution out there. This is the courage that you need to find the solution. Keep going at it because your body is made in the image and likeness of God, and it gives symptoms for a reason.
And I want my divine spine.
Yeah, baby! You're amazing.
You too.